Distinguished Excellencies, partners, TB survivors, ladies and gentlemen, warm greetings from the Philippines. I speak to you today not only as the Secretary of Health of the Philippines, but as the Chair of the Stop TB Partnership Board. In September of 2023, during the United Nations high-level meeting on the fight against tuberculosis, the Philippines affirmed its commitment to ending TB by 2030. We as a country will boldly advocate for the integration of TB into the broader health and development discourses, whether in the regional or ASEAN fora or in the world stage. We are committed to leveraging our global leadership to keep TB high in the political agenda, to foster cross-sectional collaboration, and to mobilize sustained financing and innovation that will accelerate our progress towards ending TB. Today, I am proud to report that we are turning that political will into a living reality. We are pulling TB services out of the shadows and placing them where they belong, which is at the very heart of our universal health coverage framework. Our approach focuses on several key priorities: ensuring access to TB services, particularly the most vulnerable and marginalized communities, strengthening prevention and early detection, and continuing to build a resilient and responsive health system. We recognize that access to TB services is crucial. Therefore, we are bringing TB services closer to the communities through strengthened primary health care and community-based interventions. We have intensified active case-finding efforts to reach the unreached. A key initiative of the Department of Health is Purok Kalusugan, which aims to deliver comprehensive primary health care at the Purok or village level. Through this initiative, we bring essential health services closer to the people's homes, including medicines, vaccines, health education, preventive services, and such as screening for TB and HIV, management of hypertension, diabetes, mental health, nutrition, and other priority health services. Equally important is our commitment to innovation. The Philippines continues to scale up the use of new technologies for early detection through the deployment of artificial intelligence-equipped ultra-portable chest X-rays that enable faster and more accessible screening in communities. At the same time, we are working closely with local government units and communities to ensure that TB services remain accessible, responsive, and centered on the needs of patients and their families. Prevention is also a critical pillar of our strategy to end TB. We continue to strengthen contact investigation and expand advocacy for TB preventive treatment or TPT. One of our major initiatives is the TPT Todo campaign, which promotes awareness and highlights the importance of taking TPT and encourages early health-seeking behavior and emphasizes the value of protecting families and communities from TB. In the area of health promotion, our spirit of unity was evident in March 2024 during the World TB Day commemoration. At the heart of Manila, over 5,500 Filipinos, health workers, partners, students, and survivors breathe as one to set the Guinness World Record for the largest human lung formation. While the record was a milestone, its true power was in the message it sent to the world that by standing together, we proved that we can finally break the stigma that has stifled progress for centuries. We back all these actions with the weight of our resources. Our country continues to prioritize TB within our national health agenda. We increased domestic financing this year and are currently enhancing our national health insurance TB benefit packages to cover comprehensive care for all types of TB, including TB infection. These efforts aim to ensure that no Filipino is denied access to TB diagnosis, treatment, or care due to financial barriers. Lastly, ending TB requires collective action. We remain deeply grateful for strong partnership and continued support among national government agencies, local government units, global and local partners, civil society organizations, and patient support groups who are working alongside us in advancing research, adoption of effective, shorter, and patient-friendly treatment regimens, strengthening health systems, and supporting communities affected by TB. To end, our commitments made at the UN high-level meeting serve as both our guide and call to action. For the Philippines, these commitments reinforce our resolve to accelerate progress, close gaps, ensuring that no one is left behind. The Philippines remains steadfast, united in purpose and commitment, because yes, together we can end TB by 2030. Thank you.